More than 203,000 Americans have been killed by COVID so far, and some projections say that number could nearly double by the beginning of next year. Amazing. The United States also has more than 7 million people who have tested positive, and many of them are now turned long haulers, meaning they have been battling related health problems for several months. And we've been speaking with survivors over the past couple of weeks here, and their stories have been illuminating. If you've had COVID and would like to talk to us about your long-term battles with it, we'd want to hear from you. And we even have you as a guest on our program here to tell us your story. You can email us at rfl@rnntv.com or send us a tweet or handle at LarryEP13. Let's bring in our guest, Manuella Fehertoi. She tested positive in March, and she's had health complications ever since, including suffering a minor stroke in May. She's also a severe asthmatic who has an oxygen-related issues, making this problem even worse. And like so many long haulers that we're going to talk about, this wasn't just a bad couple weeks here or a month. For 6+ months, your life has been upended. Give an idea. In March, it sounds like, Manuela, your story started off like many. There was symptoms, but they weren't bad, but they quickly went from bad to worse.
That is very true. And thank you, Richard, for having me. It's a pleasure to be with you and share my story. Yes, my symptoms were, the usual, the loss of smell and taste, the shivers, the high temperature, body aches, and suddenly it just seems to just take a life of its own. The temperature keeps rising, and I had acute pain on my chest, very, very high difficulty in breathing, difficulty also to move, to take breaths. I had pain in my back. I knew that something was terribly wrong. And upon speaking with my primary, she said that I definitely had to go into the hospital because there was nothing else that I could do at home to help.
In sharing your story, so much of it's about your family, because obviously you have a very close one. And it got me when you said that your condition had gotten so bad they had to call an ambulance to get you, to bring you to the hospital. And your husband, he welled up because he didn't think he'd ever see you again.
That's true.
And walk me through in the audience, because, you haven't even seen your grandson before, 2020 started because of all these health concerns. And this is as much you suffering, but also your family suffering along with you.
Absolutely, it's so true. I mean, my husband, he's been my rock. He's been there for me since the beginning. He stayed home to help me cope with everything, and he was my nurse. He was my friend. He was my doctor. He was everything, taking my vitals 3 times a day, and he was just so incredibly scared for me. And for my family, my whole family has suffered through it all. It was very hard on them because, especially at the hospital, they had no way of knowing what was happening to me because everybody was cut off from information. And subsequently, when we were able to see each other and get together, it was, as you can imagine, a very emotional reunion.
And to give an idea of the journey that Manuela has gone on, at points it got so bad that you were getting so little oxygen, you literally couldn't speak for a week. Your skin, on fire enough they had to pack you in ice. You covered up rashes. We mentioned the stroke. You've also, hair's fallen out in chunks as well. To do simple things like getting down the set of stairs, it'll take you 20 minutes at times here. And like I've heard from so many other people who fit into your category of long haulers, they feel like they're underwater, and that everything is on top of them and everything's so heavy, and these debilitating headaches are such that it almost hurts just to get out of a chair. Is that part of this? Is that what people can't understand unless they're going through it? That it's every day that there's pain and exhaustion involved?
It is. It's very much every day. There are days, Richard, that don't want to get out of bed. Everything hurts so much that I simply don't want to move. When I move to, I come downstairs and I start to make breakfast or dinner or whatever. I don't last more than 10 minutes standing up because that alone, it's so exhausting. My body just can't handle it. I have to sit down, and my husband has to take over, or the children if they happen to be visiting.
Obviously, this is a pandemic, but as is everything in 2020, there is politics involved. When you were going through all this and you heard the president saying things like this was all a hoax, it was disappearing, only old people were getting it, the no need for people to wear masks, minimizing science and medicine. What was it like going through what you went through to hear that from your president?
It was a slap in the face, basically. There was no empathy to what I and so many were going through. We were being dismissed. Everything that was happening to us, it's over the top, made up, and it was. It really was very hypocritical and wrong.
Well, you've been through too much. I certainly hope the coming months your health turns for the better here, and I really appreciate you sharing it. And as we've learned here, and I've learned, Manuel, there are so many people, there's a term from long haulers right now that aren't in that category on the graphic of how many people died, but still how many people are suffering, and it's well over 100,000 people that fit into your category, and it's a population that's not being heard from enough. I appreciate your time with us, though. Thank you so much.
Thank you very much. Appreciate it too. And a shout out to Survivor Corps and Diana, the Facebook page that has helped so many of us with support, information, and having shoulders to lean on.
And we have that Survivor Corps information right now up on the screen here. It is a fantastic resource. Knowing other people, if you're going through what Manuela is, there's other people as well, and they're sharing their stories, and they can relate to what you're dealing with. So again, Manuela, thank you.
My pleasure. Thank you for having me.
All right, when we come back, obviously there's been no shortage of President Trump, but what has been noticeable is how much of it is coming from not only Republicans, but for people who the president hired himself. You'll be shocked at some of the criticism and the amount of people who say they work for him and they won't vote for him.